In this podcast episode, Dr. Yvonne Burkart delves into the hidden toxins present in everyday household products that can burden our detox pathways, drive disease, and potentially increase the risk of cancer. She highlights the significant drivers of indoor air pollution, such as scented candles, and provides compelling reasons to avoid them. Dr. Burkart also discusses various other household items and practices that contribute to indoor pollution and offers healthier alternatives to create a safer living environment. Firstly, Dr. Burkart explains that scented candles are a major source of indoor pollutants like formaldehyde, toluene, and benzene, which are known human carcinogens. These chemicals are released into the air when candles are burned, posing health risks, especially to children and pets. Even when not lit, synthetic fragrance chemicals in candles continue to be released into the air, contributing to continuous exposure and indoor air pollution. Additionally, the dyes used in candles can be carcinogenic, adding another layer of risk. The lack of regulation in the candle industry means consumers may unknowingly expose themselves to harmful chemicals. Dr. Burkart recommends switching to healthier alternatives like beeswax candles with untreated wooden wicks, which release fewer pollutants. Dr. Burkart also emphasizes the importance of taking off shoes before entering the home to prevent bringing in dirt, germs, and pollutants from outside. She highlights how shoes can spread contaminants throughout the home, stressing the need to keep living spaces clean and free from harmful substances. Another significant point discussed is the avoidance of fragrances in the home, including scented plug-ins, air fresheners, and diffusers that release synthetic fragrance chemicals into the air. These products contribute to indoor air pollution and pose health risks, especially in enclosed spaces. Dr. Burkart advises opening windows to improve indoor air quality, as indoor air can be 3 to 5 times more polluted than outdoor air. She shares her personal experience of testing air quality in her office and the significant improvement after using an air filter. She recommends using air purifiers with carbon and HEPA filters to remove pollutants from the air. The podcast also addresses the impact of synthetic textiles on health. Dr. Burkart explains that synthetic textiles, such as polyester, acrylic, and nylon, release microplastics into the air when moved or worn. She advises against buying new polyester clothing and suggests opting for natural fibers like cotton and bamboo to minimize exposure to harmful chemicals. Supporting detox pathways is essential for overall health, and Dr. Burkart recommends drinking clean water, eating whole foods, and avoiding ultra-processed foods. She explains that water filtration is crucial due to water pollution concerns. Engaging in weight-bearing and cardiovascular exercise and consuming sulfur-rich foods can help boost glutathione levels, a master antioxidant that protects cells from toxic damage. The discussion extends to feminine hygiene products and the potential risks associated with conventional period products. Dr. Burkart emphasizes the importance of choosing organic and chemical-free period products to reduce exposure to toxins in the sensitive genital area. She mentions the brand Plant Paper as a safe option for unbleached bamboo toilet paper that has undergone testing for contaminants. She also warns against using scented period products, as they often contain undisclosed synthetic fragrance mixtures that can be harmful. She recommends opting for organic cotton reusable pads and period panties as safer alternatives. Moving on to cookware, Dr. Burkart highlights the dangers of non-stick cookware, particularly those made with Teflon. The coatings used in non-stick cookware can contain chemicals like PFOA, which are known to be harmful. She recommends using stainless steel, cast iron, or solid ceramic cookware as safer alternatives. She also cautions against using scratched non-stick cookware, as it can release harmful particles into food. Dr. Burkart also addresses the issue of microplastics, particularly in tea bags. She references a study that found up to 11 billion microplastics and nanoplastics in a single cup of tea brewed with nylon tea bags. She emphasizes the importance of choosing tea bags made from safer materials that do not contain microplastics. She discusses the connection between microplastics and heart health, citing a study that found a higher risk of heart attack, stroke, and death in individuals with microplastics in their arterial plaque. One of the key topics discussed is the presence of microplastics and nanoplastics in our bodies, particularly in plaque found in the arteries. Dr. Burkart explains that a study found a correlation between the presence of these plastics and inflammation in genes associated with disease. This discovery underscores the potential health risks posed by microplastics and the importance of reducing exposure to them. Dr. Burkart recommends using a reverse osmosis water filter to avoid microplastics in drinking water and avoiding plastic water bottles, which can also contain microplastics. Additionally, she suggests avoiding processed foods packaged in materials that can leach toxins. The conversation then shifts to the benefits of saunas as a bonus intervention for detoxifying the body. Dr. Burkart explains that saunas can help induce sweating, which can aid in the elimination of environmental toxins from the body. She discusses the potential benefits of traditional saunas and infrared saunas, highlighting their role in promoting detoxification and reducing overall toxin burden. In addition to saunas, she mentions the importance of cold plunges or cold showers as a simple way to support the body's detoxification processes. Exposure to different temperatures can help stimulate an adaptive response in the body and enhance detoxification pathways. Another practical tip shared by Dr. Burkart is a hack for reducing arsenic exposure in rice. She explains that rice plants have a tendency to absorb arsenic from the soil, making rice a potential source of this toxic substance. By parboiling rice before cooking it, individuals can remove a significant amount of arsenic, reducing their exposure to this harmful compound. The podcast also addresses the presence of chloroquat in oat products, a chemical linked to health concerns. Dr. Burkart advises opting for organic oats to avoid exposure to chloroquat and other synthetic chemicals used in conventional farming practices. By choosing organic oats, individuals can reduce their intake of potentially harmful substances and support their overall health. One of the key points raised in the podcast is the presence of toxic chemicals in dry cleaning processes, specifically highlighting the harmful effects of certain ingredients used in dry cleaning. Dr. Burkart stresses the importance of minimizing exposure to dry cleaning chemicals and opting for eco-friendly alternatives to reduce health risks. She also discusses the concept of greenwashing, where deceptive marketing tactics mislead consumers into believing that products are healthier or more eco-friendly than they actually are. The conversation shifts towards the use of laundry detergents and fabric softeners, cautioning against products containing fragrances and optical brighteners. Dr. Burkart recommends opting for non-toxic, fragrance-free alternatives to minimize exposure to harmful chemicals. She also addresses the issue of misleading labeling in certain products, urging for greater transparency in ingredient lists to empower consumers to make informed choices. Dr. Burkart shares her personal journey of transitioning to a low-tox lifestyle after experiencing health issues related to environmental exposures in her workplace. She emphasizes the importance of questioning conventional practices and taking control of one's health by making conscious decisions to reduce toxic exposures. The podcast concludes with a message of hope and empowerment, encouraging listeners to make small changes each day towards a healthier lifestyle. Dr. Burkart emphasizes the ripple effect of these changes, not only benefiting individuals, but also future generations, by reducing the toxic burden passed down through generations. She highlights the importance of education, awareness, and proactive steps in mitigating the risks associated with environmental toxins and promoting overall health and longevity.